Okay, I'm using this printed out sheet of the medical history questions for this video. But to start, knock knock. Hi, my name is Anna Sophia. I'm going to be your student nurse today. Could you tell me your name and date of birth?
My name is Aisha Khan and my date of birth is August 26, 2005.
Okay, would you like me to call you Aisha or Mrs. Khan?
I prefer Aisha.
Okay, Aisha, do you have any allergies?
I don't.
Okay, do you know where you're at right now?
I do.
Where are you at?
The hospital.
Okay, and then do you know what today is, the date?
October 19th.
Okay, sounds good. Okay, Aisha, I'm just going to ask you some questions to try to better understand why you're here. I know you came in today for some headaches, so could you tell me a little bit about where those headaches are located?
I'm experiencing some pain like around my temples.
Around your temples. Does it radiate to anywhere else, maybe behind your eyes?
Yeah,
Yeah.
behind my eyes.
Could you rate the pain on a scale of 1 to 10?
I'd say like a 6.
A 6, okay. And then have you found anything that helps the pain, like any ibuprofen or like ice packs or things like that?
Yeah, I've been taking ibuprofen and that's been helping.
Okay, are these constant headaches or are they just coming every now and then?
Every now and then I would say.
Okay, well now I'm going to go ahead and jump into some questions about your medical history. So first, what gender do you identify as?
Female.
Okay. Is this the gender you identified as at birth?
Yes.
Okay, and then are you currently on any medications?
No.
Do you have any past medical history?
No.
Any surgical history?
No.
Any recent hospitalizations?
No.
Okay, what about your family? Do you have any chronic or genetic diseases?
No.
Okay. And then what about, do you smoke?
No.
Do you use recreational drugs?
No.
Do you drink alcohol?
No.
And then do you feel safe at home?
Yes.
Do you have a good support system?
I do.
Okay, good. I'm going to go ahead and get started on the physical assessment portion of this. I'm going to start with your face. So if you could look at me and could you smile? Could you raise your eyebrows? And then I'm going to go ahead and take a look at your mouth. Could you open up? Okay, it's looking pink and moist. That's nice. Now I'm going to go ahead and assess your eyes. You can go ahead and just look at my nose. Yeah. Okay, I'm going to check this eye. Okay, and now I'm going to go ahead and have you look at that shelf. And now look at this pen. Okay, your eyes are equal, round, and responsive, which is good. Now I'm going to go ahead and move to your arms. I'm just going to go ahead and check your temperature. Okay, your skin's feeling warm. I'm going to check for your pulses. Okay, +2 on both sides. I'm going to check your skin turgor, which is just how we check for hydration. And you're looking hydrated, no tenting. I'm going to have you grip my fingers. Okay, those are strong and equal. Check your capillary refill on both fingers. Okay, less than 2 seconds, which is good. Okay, now I'm going to go ahead and move to your chest. And usually for a normal assessment, I would have my patient pull their gown down, but for the sake of the video, my patient's going to keep her top on. I'm going to go ahead and start by inspecting your chest. It's looking symmetrical and normal. There's no barrel chest. It doesn't look like you're experiencing any shortness of breath. Is that true?
Yes.
Okay. I'm going to go ahead and start by feeling your chest. Would you tell me if you're experiencing any tenderness?
Mm-hmm.
Okay, no tenderness is good. And now I'm just going to go ahead and take a listen to your chest. Each time I place my stethoscope, could you take a deep breath?
Yes.
Okay. Okay, your lung sounds are clear. I'm going to go ahead and take a listen to your heart so you can just go ahead and relax.
Okay.
Okay, that sounds normal. I'm just gonna go ahead and flip this over and listen for any heart murmurs.
Okay.
Okay, everything sounds normal there. There's no indication of heart murmurs. I'm gonna go ahead and move to your posterior side, and I'm just going to inspect it again. Okay, everything here is looking symmetrical and normal. I'm gonna go ahead and feel for any tenderness. Just let me know if you're feeling any. Okay, no tenderness. I'm gonna go ahead and listen for your lung sounds again. Just take a deep breath each time I place my stethoscope.
Okay.
Okay, your lung sounds are clear. Now I'm gonna go ahead and have you transition and lay down right here. So I'm gonna move this stool and have you lay down. You can lay down facing that way. Yeah, go ahead. Now I'm just gonna go ahead and assess your abdomen. Let's get this chair. There we go. Perfect. Okay, I'm gonna go ahead and take a listen and just listen for any bowel sounds.
Okay.
Okay, bowel sounds were present in all 4 quadrants. And again, for this abdominal assessment, I would usually have my patient lift her gown up, but just for the video, she's gonna keep her clothes on. Now I'm just gonna go ahead and feel around for any tenderness and just let me know if you're experiencing any. Okay, no tenderness. You can go ahead and sit up. And when was your last bowel movement?
Yesterday.
And then are you passing gas okay?
Yes.
Okay, sounds good. And now I'm gonna go ahead and have you switch back over to the stool, and I'm just gonna go ahead and assess your legs. You can scoot it back this way, and you can take a seat. Okay, I'm just going to lift your pants up real quick. Oops, sorry. Okay, I'm gonna assess for temperature. Okay, feeling nice and warm. I'm gonna feel around for any edema. Have you been experiencing any swelling in your legs?
No, I haven't.
Okay, there's no signs of edema, which is good. I'm gonna feel for your pulses. Okay, +2 on both sides. I'm gonna feel for your pulses right here. Okay, +2 on both sides. Going to go ahead and have you push on my hands, pull on my hands, pull up on them. Okay, strong and equal on both sides. I'm going to check for your capillary refill on your toes. Okay, +2 on both sides. Now you can go ahead and relax. I'm just going to go ahead and check for your reflexes. You can go ahead and hang your feet down. +2 on that side, or 2+ on that side. Okay, and 2+ on that side. Okay, and that'll be all for this assessment. Do you have any questions for me?
I don't.
Okay, I'll be sure to go ahead and tell your provider all my findings and all of your symptoms.
Thank you so much.
Yep, thank you.